Medicare will cost you in 2022 depends to some extent on the amount and kind of medical treatment you will need during the year. Because of that, no one can give you a 100% accurate, to the penny prediction of your Medicare costs for the rest of the year. However, in this video, we'll give you all the information you need to make an educated estimate of your Medicare costs for 2022. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new, helpful Medicare content every week. And as always, if you have Medicare questions, feel free to give our office a call at 877-312-1414. Let's go through the costs associated with Medicare Parts and Medicare Plans so you can figure out what your Medicare coverage could cost you in 2022. For each part and plan, note which expenses are required and which are likely for you based on your normal healthcare needs. I'll also mention the worst case scenario amounts where they exist, so you can be prepared if you have a catastrophic illness or injury and end up needing far more medical care than you normally do. First, the parts of original Medicare, Part A and Part B. Medicare Part A is inpatient or hospital coverage. If you or your spouse worked 40 quarters, which is 10 years, and had Medicare taxes taken out during that whole time, you will not have to pay a monthly premium for Medicare Part A. You prepaid that premium with your taxes. If you haven't paid Medicare taxes for 40 quarters, you can still enroll in Medicare Part A, but you will have to pay a monthly premium for it. If you paid Medicare taxes for fewer than 30 quarters, the standard Part A premium is $499 per month. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $274 per month. Medicare Part A has hospital deductibles and coinsurance amounts that are your financial responsibility if you need inpatient care. These costs are per benefit period, not annual charges. So you could potentially owe these amounts more than once in a calendar year. There is a link to a video above and in the description below that explains Medicare Part A benefit periods. A very limited benefit for skilled nursing facility care is also included in Medicare Part A. You only qualify for this coverage if you first had a 3-day inpatient hospital stay. These costs are also per benefit period, not per year. Hospice care is covered at no cost to you. Hospice drugs may have a copay of up to $5, and there may be up to a 5% coinsurance charge for respite care. Durable medical equipment is covered by Medicare Part A at about 80%, leaving about 20% as your responsibility. Here is a summary of required and potential Medicare Part A costs for 2022. For more detailed information, please follow the link in the description below. Medicare Part B is outpatient insurance. The monthly premium for Medicare Part B for most people in 2022 is $170.10 per month. If you have high income, you may be charged more for Medicare Part B. The chart on the screen shows which income levels qualify for the income-related monthly adjustment amount, also known as IRMA. Please note that Medicare looks at your modified adjusted gross income from 2 years ago to determine your IRMA payment. There is an appeals process that you can make use of if your income has declined significantly in the past 2 years. A link to the IRMA appeal form is in the description below this video. Medicare Part B covers preventive care at 100% with no cost to you. There is a link in the description below to a PDF guide from Medicare that explains which preventive care services are covered at 100%. Medicare Part B has an annual deductible that you have to meet before Medicare Part B will pay anything for outpatient services that are not preventive care. In 2022, that deductible is $233. You pay the full cost for outpatient care until you reach that $233 in spending. Depending on the complexity of your outpatient care, it could take several office visits to reach that $233 deductible. If you do reach the Medicare Part B deductible, Medicare will pay 80% of your covered outpatient medical services for the rest of the year, leaving 20% as your responsibility. Medical care is billed to Medicare Part B for all outpatient care. Even if you are in a hospital, if you have not been admitted as an inpatient, your medical care will be covered by Medicare Part B rather than Part A, and your costs will be 20% of the total cost after the deductible is met. Here's a summary of Medicare Part B potential costs. Most Medicare beneficiaries do not have just Medicare Parts A and B. Almost everyone has additional coverage to protect them from the financial risks that are built into Medicare Parts A and B. There is no out-of-pocket spending limit with either Medicare Part A or Medicare Part B. So there's no limit to how much you can end up spending with the Medicare Parts A and B deductibles, copays, and coinsurance amounts. In addition to not having any way to cap your spending with Original Medicare, Medicare Parts A and B do not cover some things that group health insurance and individual health insurance have evolved over the years to include. If you only have Medicare Parts A and B, you won't have coverage for most outpatient prescription drugs, most dental care, including dentures, most vision care, long-term care, or hearing care, including hearing aids. Medicare supplements, also known as Medigap plans, are the oldest type of Medicare plan offered by private insurance companies. These policies work with Medicare Parts A and B. Medicare Parts A and B are primary insurance, and a Medigap plan or Medicare supplement is secondary insurance. There are many different levels of coverage available with Medigap plans to help you cover the deductibles, copays, and coinsurance that would otherwise be your responsibility with Medicare Parts A and B. The monthly premium cost for a Medicare supplement depends on what level of coverage you choose and where you live. A high deductible Medigap plan can have a premium of below $50 per month, while the most comprehensive Medigap plans premiums can be several $100s per month. Unless you have a high deductible Medicare supplement, you will have very few out-of-pocket costs when you need medical care during the year. You can budget for the Medicare supplement monthly plan premium and then expect very little in extra charges for services that are covered under Medicare Parts A and B for the rest of the year. For more information on the best Medicare supplement plans for 2022, please see the video linked above. Here are your potential costs with a Medicare supplement, also known as Medigap plan. Medicare Part D is prescription drug coverage. Part D coverage can be purchased through a standalone Part D plan or as included coverage in a Medicare Advantage plan. Medicare Part D, like Part B, includes an IRMA payment if you have high income. The chart on the screen shows how much you will pay in addition to the plan premium if you fall into one of these high income categories. This extra amount does not go to the Part D insurance company. It is paid to Medicare. Part D IRMA applies whether you purchase your Part D coverage in a standalone plan or as included coverage in a Medicare Advantage plan. The only way to avoid Part D IRMA is if you have creditable drug coverage from another source, like an employer plan, the VA, or a state pharmaceutical assistance program. If you don't take any medications or take just a few generic inexpensive medications, you may be tempted to skip Part D to save some money. Unfortunately, that is a risky move that could cost you a lot in late enrollment penalties down the line. More info on that in the video linked above. Even though Part D is a part of Medicare, coverage is not offered through Medicare itself. Private companies contract with Medicare to offer Part D prescription drug coverage to Medicare beneficiaries. Part D plans have to meet annual Medicare standards before they are allowed to be marketed to the public. Every Part D plan has to be at least as good as the Medicare Part B defined standard benefit plan. Because Medicare makes adjustments to the Part D defined standard benefit plan every year, all the Part D plans change at least a little every year. It's very important to look at all your Part D coverage options every year during the annual enrollment period between October 15th and December 7th. The best Part D plan for you this year might not be the best plan for you for next year because they all do change. How do you shop for Part D plans? Do not start by looking at the monthly premium cost. The plan with the lowest monthly premium may not end up being the least expensive plan for you. Similarly, whether a Medicare Part D plan has a deductible or not might not matter. You have to look at your overall cost, not just premium and deductible amounts. Part D plans are complicated. There are 4 different coverage levels: deductible, initial coverage, coverage gap, and catastrophic coverage. How much your prescriptions cost to fill sometimes depends on which coverage level you are in. How far you progress through those levels depends entirely on the cost of the medications you take. Just looking at the premiums, deductibles, and co-pays of plans generically doesn't give you useful information. The only way to get an accurate cost estimate for Part D prescription drug coverage is to enter all of your medications into a plan estimator tool, either at Medicare.gov or through an insurance brokerage. These options will give you the most accurate and fastest estimate of all plans available in your zip code. What you are looking for is the plan with the fewest restrictions and lowest overall cost based on your medications. Here are your potential costs for Medicare Part D. Medicare Part C is Medicare Advantage plans. These are, for the most part, the HMOs and PPOs of Medicare. Like Part D, Medicare Part C plans are offered by private insurance companies that contract with Medicare and have to meet yearly standards in order to be allowed to market their plans to Medicare beneficiaries. If you enroll in a Medicare Advantage plan, you have to continue paying your Medicare Part B premium and your Medicare Part A premium if you owe one. Medicare Advantage plans may have a monthly premium, although there are many that have a $0 monthly premium. There are deductibles, co-pays, and co-insurance amounts for all medical services received through a Medicare Advantage plan. The amounts for those vary from plan to plan. Use the plan's summary of benefits and evidence of coverage documents to estimate how much you will likely spend in a year on deductibles, co-pays, and co-insurance if you use your usual amount of medical services. Every Medicare Advantage plan also has a maximum out-of-pocket spending limit for the year. If you reach that limit, all further covered medical costs for the year will be covered by the plan. That maximum out-of-pocket spending limit is important to keep in mind as you're shopping for Medicare Advantage plans because it represents the absolute worst-case scenario for that plan. In 2022, this limit cannot be higher than $7,550 for in-network care. If your Medicare Advantage plan includes Part D drug coverage, those costs will be estimated separately in the plan information, similar to quoting a standalone Part D plan. Here are your potential costs for Medicare Part C. You can't have a Medicare Advantage plan and a Medicare supplement at the same time. And in most cases, you can't have a Medicare Advantage plan and a standalone Part D plan at the same time. The most common choices for coverage are either original Medicare Parts A and B plus a Medicare supplement, a standalone Part D plan, and possibly a dental, vision, and hearing policy, or a Medicare Advantage plan. With either option, you have to pay your Medicare Part B premium and your Medicare Part A premium if you owe it. Beyond that, your costs for 2022 can be estimated by adding together plan premiums and likely expenses based on deductibles, copays, and coinsurance for each plan. This can get complicated, but help is available. If you have questions about your Medicare coverage or would like some help figuring out how much Medicare is likely to cost you in 2022, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help you sift through Medicare confusion to find the best possible coverage option for you. Have a great day.